WOWT6. This is Heartland Focus.
Hey, good morning and welcome to Heartland Focus. I'm your host, Tim Clark. We have a great show for you this morning. We have the President CEO of Department of Health and Human Services for the state of Nebraska. So that's very important. She's a very busy lady that's going about the business of putting together strategies for the state as it relates to our vaccination, the vaccine, also working on initiatives to help to mitigate the risks of that virus. And so we're going to spend some time doing a deep dive in terms of what really is being done, what's happening now, and then what the work in terms of the future, what we have to do some heavy lifting to make sure that we're being very intentional about the strategies to help get rid of this insidious virus called COVID-19. So I want to welcome Danette Smith, CEO Smith. Welcome to Heartland Focus.
Well, good morning, Tim. Thank you so much for having me on your show again. I appreciate it.
Yeah, I really enjoy having guests like yourself. It just because the topic is so rich and there's so much information and we never have enough time, right? And so that's why I got to kind of, I got to talk to your assistant and get you on a consistent basis because this is important. It's important stuff. So if we could start off by just, if you give us the kind of a high level state of what's happening here in Nebraska when it comes to the vaccination process, COVID-19, and some of the efforts that is underway with your department.
Absolutely, and I'm happy to give kind of an update. Well, as you know, we started with the distribution from the federal government of the dosages back in, I think it was close to the second to the last week of December. We started receiving the Pfizer product and started the last week of December all the way to now in our distribution of the 2 vaccines that are available to us. And you know that those vaccines are Pfizer and the Moderna that are available to us right now. And so the state has been in coordination with the federal government in making sure that those vaccinations get out to all of our providers. And one of the things, Tim, I'd like to clarify is that there is some thought that we have a large refrigerator. Those dosages of vaccines or products come in and we're storing them somewhere here in Nebraska. We actually aren't. What is happening is the state's role is to coordinate the distribution, which means we put the orders in from the local jurisdiction. We make sure they go into the federal CDC platform to be filled. And then the federal government fields those vaccination requests and sends them directly out to our providers all across Nebraska.
So there's no, Army guards, watching and standing by protecting some big old ice box somewhere in the middle of Nebraska.
Absolutely not. All of the vaccines are being transferred in a very methodical kinds of way. You've heard a lot of us talk about the cold chain and making sure that they're cool and they're stored appropriately. And so all of that, the federal government handles to make sure that our providers get those dosages out and that from that distribution at the federal level, then our providers are able to get it out to the community. As you know, we started out with making sure that all of our healthcare providers were getting vaccinated. As you know, without our healthcare providers, both in the community, in the hospitals, we wanted to make sure that the people who are taking care of us are protected and they are safe. I
love that you're going straight line to, versus trying to create another layer that you're sending the product directly to the service providers. And as you look at that, I love that. So that's first thing. But as you look at the whole, people are like, well, dang, why are we not going faster? Why are you not having a 24/7 operation of just sticking people, right?
Right.
Well, talk about that a little bit, because part of it is you only can do you only can do so much in terms of what you have. So, but what is that? Why we can't do it 24/7, where people can, because you got people on all different types of shifts, working third shifts. We're in the middle of a pandemic, a crisis. So it's like wartime, right? So
and Tim, we're treating it that way, as though we're in wartime. As you know, we've had the vaccinations or the product, both Pfizer and Moderna, and I'm going to keep repeating that because I want people to know the products that we're getting here in Nebraska, which is the same everybody's getting across the country. But we've had ebb and flows with the product being shipped to Nebraska. For example, sometimes we're able to get 11,500 vaccinations, and we're told that that's what we're going to get. And sometimes we get less. And then there's been times where we've been told that we're going to get 20,000, and then we may get more. We may get 25,000.
And you can't control that. You can't control that.
We can't always control that. That's correct. We cannot control it. But the good news about our providers is that our providers are working very closely with the state to make sure that we are inoculating everybody based on our state priorities.
And right now, where are we at right now? Are we still in 1B?
We are still in 1B, and I want to reemphasize that we are inoculating 85 and plus, 65 and plus. That's where we are right now.
And so I know there was some language out there that said, hey, I don't know, based on scientific facts, but it was something that I heard in terms of just that the prioritization is more driven based on age versus comorbidities. Talk to us about that a little bit.
Absolutely. Tim, this is both a plus and also an opportunity. We're learning a lot about this virus and how it impacts people by age. And one of the things that we've learned about this virus is that we need to make sure that we are inoculating the most vulnerable people in our community. We have learned that in order to do that, we've got to start with our elders in our community. Hence why we're going to be inoculating all those persons 65 and older, and then we'll be looking at how we inoculate persons by age category. I know that with the science and some of the data that we've seen at the state has told us that the most vulnerable people in our community are those who are older, from that 64, 65 category and up. And with that being said, before you and I talk more, I want to just give some statistics, if I may. Would that be
please.
Okay?
Absolutely. Absolutely.
So we've had approximately 2,025 deaths here in Nebraska. Let me give you this statistic. 34% have been persons of 85 plus years old. 29% have been between the ages of 75 and 85 years old. 19% have been between the ages of 65 and 64, and 11% has been between the ages of 55 and 64. So although persons have comorbidities, if you have comorbidities in this age range, it's really going to impact you. If you have comorbidities in a younger age, we're not saying that the comorbidity doesn't affect you, but because you're younger, you have ability to sustain it a lot better and a lot longer until we can get to you. Again, we want Nebraskans to know that we consider everybody important, and we are trying our level best to get that product out as soon as we get it, to get as many people inoculated as we can.
So the two vaccines that really has come into Nebraska is Pfizer and the Moderna.
Yes, Pfizer and Moderna.
Moderna.
Yes.
And so those two. So here, this is a great opportunity for us to really to, I'm hearing, I've heard somebody called me actually and said, well, I don't know if I should get my vaccine in North Omaha and South Omaha, because I think they may be sending a different type of vaccine to those communities that's different than the ones out west. It's the same stuff. I'm hearing that type of things, and people are thinking that there's less than in terms of services and quality in some of those areas. Talk to us, CEO Smith. Talk to me about that in terms of just, is it consistent across the board of what you're giving out and all that good stuff?
Absolutely. We are giving out Pfizer and Moderna across the state. And one of the things that I've been so proud about with my incident commander, Angie Ling, she is making sure that all products are equitable across the state. So we're not picking out Moderna just for North Omaha and South Omaha. That is not how it's done. Douglas County, the Public Health Department has both products, and we allow them to be able to distribute those, to all of their providers there in the county. They make that decision, but I can tell you that I know that they are being equitable in being able to distribute that product. So the thought of that only North Omaha gets Moderna and all the rest of Douglas County gets another product, I would probably tell you that's not true. They are spreading the product equitably across the state, and I know that they're doing it by jurisdiction.
And really, if you could, really, what is the difference between the two? There's very, very much a strong, there's a strong, in terms of just similarities. It's pretty much you're getting almost the same vaccine. Do you know what's the difference between the two?
I really don't. I'm not the medical professional. I can only tell you that one product, it's 28 days for the second dose, and another product, I think, is 26, and please don't quote me on that.
Yeah.
Both dosages are between 90 and 93% effective. And, one of the things that we really want the community to understand is that the vaccine allows an extra protective layer of covering during this time.
And really,
So
when you think of, I
layer
like that. I like that. So what we're going to do, we're going to take a break, CEO Smith, but I want to stay there about the whole notion of that extra layer of protection. And when we come back, let's talk about that, especially in really in light of like a flu shot, all of that in terms of just to help prevent, but not so much will it stop you from getting something, but how do we slow it down? And so when we come back, we'll ask more questions of CEO of the Department of Health and Human Services for the state of Nebraska, Danette Smith. Stay with me. We'll be right back. Hey, welcome back to Heartland Focus. I'm your host, Tim Clark. My guest is the CEO of the Nebraska Department of Health and Human Services, Danette Smith. Hey, Danette, thank you so much for this meaningful conversation that we must have. So boy, I need more time. It's like, Dave, in my ear, my producer said, hey, we're running out of time. We're running out of time. I need more time with you. I know you're going to make yourself available for that. So I appreciate that. So as we look at moving forward, the work. Now, as we look at, there's still, CEO Smith, a lot of black folks that they just don't trust. They don't trust that the system, the government, is going to do right by them. Talk to me. How do we get them? How do we reel them in a little bit more?
Well, I think what the Department of Health and Human Services is doing with all of its partners, our local public health departments, our FQHCs, and I certainly in Douglas County want to acknowledge Dr. Audie Poore and her staff, as well as Kenny McMorris and Andrea Skoklin, all who are working tirelessly with the department to make sure that our FQHCs are there to inoculate communities of color, both the Hispanic and African American communities. And they've done a fabulous job with trying to get the word out. So here's what I'd say to you, Tim. All of us, all of our partners, we are taking this seriously. We are looking at how we educate our community with good information, not just folklore, but good information. As I've said to you when you and I have talked offline, I have been raised with some of those folklores as to why
Yeah.
we shouldn't get vaccinated. And let's be honest, some of them that we've been raised with are true. But here's what's different with this virus. This virus kills. Okay?
Yeah.
It takes no prisoner, it kills. And for those of us who are in the minority community, who also have comorbidities, we need to make sure that we are using the extra layer of protection just to make sure.
What do you mean by comorbidities? What do you mean by that?
Sure, comorbidities are hypertension, diabetes, heart failure. Those are some asthma. Those are some of the comorbidities. You know, in the African American community, we have hypertension, we have diabetes. And so when your prioritization group comes up, we encourage you, we strongly encourage you, we cannot force you, but we strongly encourage you to look at the vaccine as an extra layer of protection. Many people say, well, we'll just wait for herd immunity to occur. And that's around that 70% where mostly everybody is vaccinated. Well, I don't know that you want to take that chance.
And why? Because why not take that chance? I mean, because you know, I mean, I have some of my friends. Well, you know, you take it, and I'm gonna see how you respond to it. You know.
Well, let's talk a little bit about the side effects, because I think part of what I've heard is people are very concerned about the side effects. So you get the inoculation. You may feel in your arm some tenderness. It may hurt a little bit. Sometimes people get a little bit of a low-grade temperature, but it doesn't last. We ask that if you get that you just take some ibuprofen. Please do not take any medication prior to the injection. But, you know, it has just caused people's arms to be sore, swell a little bit, but nothing major. Nothing major. Then we ask you to come back in, I think, either the 21-day or the 28-day to get your second inoculation. I also have heard that through that second inoculation, you may have a little bit of a temperature, or a little bit of tenderness in your arm where that injection was done. But other than that, I haven't heard anything major occurring. Just so you know, Tim, as people are having significant adverse reactions, and we have not heard thus far, I have not in Nebraska, we are tracking all adverse reactions that are significant.
Yeah, and when you think of
that we know.
When you think about CEO Smith, how really fast that we've had to really pull together and make this happen, you're going to have some hiccups. You're going to have some folks that is going to react to this. But when you think about the greater good still, you know, I think that's the sacrifice I think we all have to be willing to accept, that something is going to happen. But, you know, for the good of humanity and for the good of really saving as many lives, because we're over 500,000 people that's dead because of this virus. So it's a little different than just, well, I'll wait and see and I'll get herd immunity and all that craziness.
That's correct.
I mean,
Tim, here's what I would say to you. I see this, when it's my time, as a personal responsibility. I have a personal responsibility to be responsible as an individual for my health.
Yeah.
But I also have the personal responsibility and community responsibility to make sure that I'm not transmitting or causing someone else to be sick. And so I have a responsibility to my community because of the virus to make sure that I'm doing my level best to keep my health at a good state. And I want to be able to make sure that I'm helping my community keep their health at a good state. So not only am I responsible for Danette, my individual health, but I'm also responsible for my community and those people that I come in contact with every day to make sure that I'm using the level of protection that protects me from getting sick.
And I tell you, I must admit, you know, I'm exhausted. There's a lot of folks exhausted. I see it here in Omaha. I see it all over the country where people is almost, they're giving up in terms of, I don't want to wear the mask no more. You know, I don't want to do social media distancing no more. It's dangerous. I mean, and I'm not speaking because I'm perfect. I'm a work in progress. I gotta be more disciplined because I'm an extrovert. I love people. I'm in the people business. So I want to touch you. I want to hug you, your CEO Smith. Okay, I want to at least touch you. But how do we for folks like me and other folks out there that just how long must they hold on, to just that discipline of just doing the right thing and really doing it for the people in front of you versus if you don't want to do it for yourself, respect the people that's in front of you. I think I heard you say that in so many words.
That's exactly correct. This is about protecting our community, and as much as we all, and as a people, we like to hug and kiss. And that's how we receive each other.
That's right.
Not only in the African American community, but I've experienced that throughout my experience in Nebraska. Yeah. I still say to people, even though you've been inoculated, please continue to wear your mask. We are not out of the woods yet. The vaccination is new to us. We're learning a lot about it. We still want you to wear the mask. We want you to wash your hands. We want to make sure that you're social distance. And we want you to stay away as much as you can from crowded places and spaces. It's so important.
Crowded places and spaces.
That's right. We're still learning. We are not out of the woodwork yet. Yes, most people are completing their second dosage, and we're happy about that. But we are still, as a state and as a nation, out of the woods, and we are not out of the woods. Excuse me. And we still need to take those precautions. I think we're going to return to some normalcy. Not sure what that's going to look like, but I think we have to take these gradual steps of getting the vaccinations and doing all the preventive measures we can possibly do to slow down the transmission of the virus.
Now, once an individual has been inoculated, talk about that a little bit in terms of because there's folks having conversation. They feel that they're free now. They can kind of do what they want to do. Talk about that a little bit. What kind of play should be in play once you get inoculated?
Well, again, it is as I've said, earlier, it is a protective covering. You're not fully inoculated until you've had the second dose. But again, we are still continuing to say, you have got to take those protective, washing your hands, putting your mask on. We still want you to do all of that. We're not out of the woods yet. You may feel a little bit more comfortable to travel, and we understand that. We're going to say, if you travel, still take the precautions, because you don't know if the other person sitting next to you on the airplane was inoculated. You don't know that. So you still need to take those precautionary steps to make sure that you are safe. And the people that you're going to see or you're traveling with, they're going to be safe as well.
Okay, hey, CEO Smith, we're going to take a short break. And when we come back, I want you to give just some practical things as we close out our next segment. Think about some things, 1, 2, 3, that we just should be focusing on and give some action steps, okay? We're going to take a short break. Coming back, we're going to wrap it up with just giving you some action steps in terms of how you can help continue to mitigate this crazy virus. Stay with me and I'll be right back. Okay, CEO Smith, thank you. But hey, 1 minute. Action step, where do we go? What's the word?
Okay. Action step number 1, get all the information off of our website, dhhs.ne.gov, about the vaccination. Number 2, have a good conversation with your provider. Ask your provider or your physician as to whether or not this is a good time for you to get vaccinated. And number 3, stay educated. Read as much information, participate on the town hall meetings that certainly we're doing at the state, but also our local jurisdictions are doing the same. They are making sure that all the information that we are giving out to the community, even at the local level, is culturally and linguistically appropriate because we want to make sure that people of color have good information. So we want Nebraskans to be encouraged, be positive about where we're going with the vaccination over the next coming months.
Awesome, awesome. That is awesome. And if folks do not have a medical home, there's still opportunities for you to make sure you're taken care of. And that's all by really accessing the various vehicles in which he spoke about. Is that right?
That is correct. Your local public health departments and your FQHCs, I can tell you they stand ready to help in any way. They've just been phenomenal partners there in Douglas.
Okay. Hey, just real quick, I just want to, and you can stay where you're at, but my birthday was January. I'm celebrating for the whole year. I'm concentrating in terms of Great Plains Black Museum. I'm 56. My challenge, I need 56 members. Omaha Star subscriptions, 56 members. So help me make that happen. That's all. I'm out of time for this episode of Heartland Focus. Make today the beginning of your best year yet. Go out there and do good yourself so it makes it so much easier to be good to others. Be good to yourself. Wear that mask, social distancing, wash your hands, go get tested, and learn the facts about this vaccine. Until next time, Tim Clark, your host. I'm out.